A patient hands you a completed GAD-7 with a total score of 13. You know that it means moderate anxiety, but what happens next? If you've ever felt like you're staring at a raw number rather than a clear, defensible roadmap to recovery, you're definitely not alone. Today, we're turning that numerical data into an exact, standardized treatment pathway, completely removing the clinical guesswork. Before we look at our first threshold, if you want to automate this entire workflow from sending out digital screeners before the intake to tracking client goals automatically, click the link below. You can grab a free 21-day trial of our all-in-one clinical case management software to try out yourself. In this quick guide, we're unlocking the exact scoring matrix used by top clinics, breaking down when to escalate to combined therapy, and showing you an automated setup that saves clinicians hours of documentation every single week. Let us change how you use metrics. Welcome back, colleagues. Today's presentation, Matching GAD-7 Scores to Evidence-Based Care, focuses strictly on actionable clinical decision support. Standardized screening scores like the GAD-7 are highly efficient, but they only provide value when they dictate precise intervention directions. Our goal is to empower your diagnostic assessments and make clinical documentation seamless. Before matching can occur, we must establish a rock-solid, shared understanding of what these ranges represent. The GAD-7 is structured as a self-reported assessment. The scoring represents a reliable reflection of DSM-5 anxiety severity parameters. Let us break down the numerical segments that guide our daily clinical care pathways. Here we see the clinical thresholds mapped clearly into 4 tiles: minimal, mild, moderate, and severe. Notice that a score of 10 is where the visual and clinical paradigms shift. According to Generalized Anxiety Disorder Clinical Guidelines, patients scoring 10 or higher possess clinically significant anxiety that mandates formal therapeutic or psychiatric intervention. When dealing with mild scores between 5 and 9, clinicians must avoid overpathologizing. Our primary clinical objective is psychoeducation. Patients thrive when we assign structured bibliotherapy or mindful routines. We establish consistent clinical checks over the next few weeks to ensure symptoms return to baseline. This structured matching matrix is your primary reference tool for daily practice. Notice how the intervention intensity scales proportionally with the score. Severe scores between 15 and 21 call for a combined treatment plan. Pairing high-intensity cognitive behavioral therapy with first-line medical options like SSRIs produces the most defensible, robust outcomes. Let's ground this clinical framework in a real patient story. Consider Rose, a patient who presented an intake with a severe score of 16. Because her therapist followed clear evidence-based anxiety treatment pathways, there was no hesitation. Rose was matched with a structured CBT and evaluated for escitalopram. Her treatment records show a dramatic reduction down to a mild score of 6 within 2 months. The numbers speak for themselves. In this bar chart, we compare clinical response rates for severe anxiety. Cognitive therapy alone is highly effective, but when a clinician matches a GAD-7 score of 15 or higher with combined medicine and intensive CBT, response rates jump to 85%. This highlights why systematic matching is so critical. Remember this number, 10. This is your primary diagnostic pivot point. Research shows that crossing this threshold is highly sensitive for generalized anxiety disorder. This is the moment where clinicians must move past monitoring and implement formal therapeutic interventions, ensuring optimal measurement-based care. Now let's talk clinical efficiency. Many clinicians spend hours manually scoring and typing up screening results. By integrating clinical rating scales into EHR documentation, the software handles the assessment prep before the client sits in your office, streamlining your overall workflow. To recap what we've covered, 10 is your clinical pivot point. Matching your GAD-7 scores with precision prevents undertreating or overtreating. For severe scores, always evaluate for a combined therapy strategy. And lastly, tracking outcomes with digital assessment features keeps your workflows compliant and patient-centered. If you're ready to put these protocols into action without the administrative headaches, try using an all-in-one mental health practice software. Check out the link in the description below to start your free 21-day trial of Case Management Hub. Automating your clinical assessments is a total game changer for your daily operations. Thanks so much for watching. We hope this step-by-step breakdown helps you implement accurate GAD-7 scoring protocols inside your clinic. If you found this video helpful, share your experience with the assessment tracking in the comments below. Once you click the link, you'll be brought to this page. Just enter your first name, last name, and email, as well as your organization name, and select your practice area. We also recommend that you enter a phone number. Let's take a look at how easy it is to create, edit, and send a form in Case Management Hub. Step 1, from the sidebar, click the Forms module and search for Basic Intake Form, and then click the title to open it. Here's a tip. Forms with a padlock are master templates provided by Case Management Hub to help you get started. You can easily customize these to make them your own. Step 2, click Edit Template to start customizing the form to your needs. Here's a tip. You can add new form fields using the right sidebar. Just drag them straight into your form. Once done, click Save. Step 3, select a client to start filling out a form on their behalf. No need to retype your client's data. It magically fills in the form for you, saving you time. Step 4, or to send the form directly to a client or clients, click Send Form, select the clients, and then click Send. Tip: you can send forms to a client that are not yet on Case Management Hub, or what we call external recipients, by clicking Add Recipient and filling out their email, first name, and last name. Step 5. Create a public link for your form so you can easily share it with anyone. Just click Copy Link to publish your online form. A link will automatically be created for you, but you can always edit this and other form settings even after creating the online form. To do this, just click on the gear icon in the top right corner of the form page to bring up the form settings. And don't forget to like this video, as it lets me know that you've received value from it. You can also subscribe to the channel so you don't miss great content like this one.